Hi, struggling with eczema? In this video, we teach you how to manage eczema. Our aim is to take you from here to there so that you can do this and this or whatever eczema prevented you from doing and have a restful sleep. I'm Sue from Rock and Herb, and in this video, you will learn how to identify and manage the triggers of eczema. We talk about three main issues. 1. Allergens and sensitizers. 2. Microbial infections. 3. Moisturization. You can jump to any part, but at the start, I recommend you watch all parts to make sure there's no gap in your management that prevents you from getting better. In eczema, the immune system reacts to typically harmless molecules. These are allergens and sensitizers that trigger the immune system to seek and destroy them, but this also destroys the skin barrier. The immune system is also less effective against microbes, prolonging attacks that weaken the skin barrier more. This lets more allergens and microbes through the skin, triggering the immune system again, thus the vicious cycle. Good eczema management reduces these triggers and protects the skin barrier. It tends to look like this: daily moisturization with occasional and minimal antibiotics, antihistamines, or steroids. If you're having to constantly rely on steroids to manage your eczema, then it could be that you have not identified all the triggers or your moisturizer does not suit you. In the next part, we show you how to identify allergens and sensitizers that could be triggering you. Any one of these everyday items could trigger eczema. But which one? A fast way to know is the skin prick test. This is a standard panel of allergens that trigger eczema, with egg, cow milk, and peanut being the most common culprits in infants. Standard skin prick tests are not a complete picture, however, as many allergens aren't automatically tested. Some of these allergens are even found in skincare for sensitive skin and eczema, and my girl's allergic to these too. If you're trying to identify triggers by simple observation, it's important to know that reactions aren't always immediate after trigger exposure. Daily photos matched to a schedule or food diary can reveal delayed triggers. For example, the pool chemicals will only trigger my girl's eczema the night after the swimming lesson, which is more than 24 hours later. If the lesson is shifted, the flare is also shifted. If you still have difficulty identifying triggers, a blood test called the RAST can provide a more comprehensive view. However, due to the blood draw, it's not frequently done on children. If you're sensitive to something that's widespread, such as everyday chemicals or dust mites, don't despair. Every small step in reducing their level helps. Also, if you're like my girl who's allergic to ingredients in the moisturizer that's supposed to be treating your eczema, we have the Epidermis Relief Cream, which is free from the pre-mentioned ingredients and hypoallergenic tested. We speak more about this in the final part of moisturization. Do share with us your experience on how you identified or avoided your triggers, and I'll see you in the next part. How do bacteria, viruses, and fungi impact on eczema, and is it holding you or your child from getting better? Welcome to our How to Manage Eczema series, where we get you from an indoor lifestyle with sleepless nights to freedom and restful nights. Besides being triggered by allergens, eczema-prone people are especially triggered by harmful microbes, which can be bacterial, viral, or fungal. Eczema sufferers often carry high amounts of staph bacteria, which can turn harmful and worsen the eczema. Using topical antibiotics on cuts and wounds can prevent infection and avoid the need for steroids. Uncontrolled staph infection can cause impetigo, leading to highly infectious yellow-crusted wounds that require antibiotics. Always consult your doctor for proper use of antibiotics and steroids. Eczema triggered by fungus can be treated with antifungal. Viruses like the cold also worsen eczema but are usually self-limiting. During this time, your doctor may prescribe you antihistamines to make you feel more comfortable. This concludes our microbial infections part for eczema management. Watch our next part on moisturization, the most crucial part and drug-free solution of eczema management. Many eczema patients struggle to retain moisture in their skin, making it easier for microbes and allergens to penetrate. Moisturizers are essential as they hydrate and lock in moisture. However, all moisturizers contain emulsifiers and additives to make oil and water mix and stop them from spoiling. Despite some of these additives being classified as clean, they can cause problems for those with severe eczema. My daughter is allergic to many of these additives, which is why she could never get better with moisturization. Instead, she needed more steroids to manage her allergic reactions to these additives. Using a patented technique, Rockenham Epidermis Relief Cream is free from these additives and has undergone rigorous hypoallergenic testing. It also includes skin barrier repairing ingredients like hyaluronic acid, ceramides, quercetin, and panthenol. Quercetin is a natural antihistamine that reduces inflammation, One of the reasons why the itch is worse during sleep is because histamine levels naturally rise late at night to early morning. Quercetin also helps lower cortisol to healthy levels, making it ideal for those recovering from steroids that mimic cortisol. My daughter has gone from being sick and disturbingly itchy all the time to healthy and comfortable without relying on steroids and moisturizing 2 to 3 times a day. In summary, know your allergens and sensitizers, remove them from your environment and moisturizer, work with a doctor to treat and prevent infections. I wish you the best success in managing eczema.